Hi everyone, and welcome to today's video. I'm Mary Felling. I'm a physical therapist and I've been practicing over 30 years. And for the last 25 years, I've been practicing in a particular area of expertise called the John Barnes Myofascial Release approach. Today's video is to teach you a simple technique to help relieve TMJ pain. Let's get started. All right, so the TMJ, temporal mandibular joint, is right here. If you take your finger along your cheekbone and you go all the way back right to in front of the ear and drop just underneath it, that's the TMJ joint. What we want to do is help release any tension around the joint that's causing it to not be able to function correctly. So you're going to take your finger, let's say, I'm going to show you on the left side, so I'm going to use my right finger. Those of you who are doing your right TMJ, use your opposite, use your left finger. So you always use the opposite hand from where you're treating. And you're going to go up and you're going to find the gum line, and then you're going to go back against your gum line to where there's this little cavern at the back of your teeth, and you kind of wheedle around in there. You won't have to go too far, and you're going to find a place of pain, tightness, or tenderness. You're on a muscle called the pterygoid. The pterygoid muscles do this. They help us to chew our food side to side, but when they get tense and tight, they create too much tension for the jaw to work normally, so it starts popping and cracking, or it might even start getting locked and too painful to open. So here's a good technique for that. So here we go. Take your opposite finger. Make sure, of course, your fingers are clean. If you have long nails, instead of a finger, use the opposite end of your toothbrush, the round handle part of your toothbrush. And you're going to go along. So as you can see, I'm right up here. I'm going along the top of my gum line. I'm going right back. My finger sticks out. So I'm like this now. I started along my gum line. Now I'm back there. And I'm feeling for it. Keep your teeth closer together. Do not open. It will be very hard to treat yourself if your mouth is open. So your teeth are like this. And I'm looking for, and I'm feeling for a tender spot. And I'm on it. It might take some pressure, like 1 or 2 seconds, to find the spot. But once you're on it, stay there. We're starting the timer right now for that 5 minutes. Remember, all myofascial release takes 5 minutes to elicit that piezoelectric effect, that electrical flow that moves right along the fascia, and when it gets back to those tight myofascial restrictions, starts rehydrating them, relaxing them, and lengthening them. Remember, once you find your spot back there, I know I'm talking very funny, once you find your spot back there, stay on it. You can wheedle around, keep your fingers in your mouth. I'm just doing a demo. You can wheedle around on a spot, moving forward and back and up and down, but don't move across the spot where now you're massaging. You're no longer doing myofascial release. Keep your finger on the point, but you can angle in different positions to help you get the best focus. You want to find the place that's really tight, and sometimes just changing the angle finds a better position that creates the tightness or the tenderness. All right, so I'm going back to that spot. You guys are still on that spot. And remember, just give yourself enough pressure where you feel it. If it's too much and you're tightening because you're about to cry, back out a little bit. Now, the other thing about this technique, it gets a little funny because you're going to start drooling. So have a tissue ready for you, yourself, if somebody's around. If you don't care, that's fine. But if you don't want to gross anybody else out, make sure you have a tissue to wipe the drool. Remember, your teeth are kind of close together. They're not really apart. You're finding that spot. You're maintaining your pressure. And it might become very painful, and if it does, and you find yourself tightening, back out a little bit. But you found a good spot. That's a good sign. You might be here and you might feel it going up across on the side of your eye. You might feel it travel back a little. You might feel it coming down or starting something in your neck. That's great. Remember, you've touched into the entire myofascial system in that area. So you could have a fascial restriction here that over the years has put so much tension through the rest of the fascial system. It's pulling and creating tenderness and tightness and discomfort in other areas. So I'm going to take my tissue because I'm starting to drool right under my finger here. And I changed my angle a little bit because I could feel it was softening. I was feeling some release. And now I want an angle that's not comfortable. I used to have TMJ pain and dysfunction. So I still have to keep up with this once or twice every week or so, just so it doesn't come back. And how it started, good question. I used to have a lot of neck pain 30, 35, 40 years ago. And I believe now that all the tension from there over the years created tension into my jaw. And that's where I had jaw pain, TMJ dysfunction, just a secondary result of some primary things going through my neck. And you'll learn as you start following more and more of these videos that once you work an area and you do feel it another, I would have you go and then treat that next spot. You want to treat both ends of a fascial restriction. I'm going to give you a little visual technique. So I'm going to take my finger out. You guys keep your fingers in on that pterygoid. And I'm going to have you close your eyes. I want you to see inside the pain or the discomfort or the tightness. We're going to do a visualization technique. And you want to get an idea of what it looks like. So you want it to be three-dimensional. Maybe it looks like a pile of bricks or a big tarry goo, a bucket full of big tarry goo. You might see mangled barbed wire, whatever the presentation is that you have in your mind's eye. See that presentation, see it softening, melting, becoming a fluid, and see it moving up towards and out towards the surface of the skin. See an opening in the skin, and get as much of that pain or tightness out from that area in your pterygoid. Get as much out as you can, and then close up the surface of the skin behind it so it can't come back in. You can come back in, and now search around in that area and see if you see anything else you need to get rid of. So we're coming up to our 5 minutes. And this is the end for me here directing you, but feel free to continue on this side or go ahead and do your other side. I do suggest that you do both sides so that you can get every possible problem that may be causing your TMJ. A problem on one side of the TMJ can cause a problem on the other. So that's why you would do both sides, because you never know which side's influencing where your pain and dysfunction is. All right, thanks again for joining me, and I will see you on the next video.